Today, we're going to cover the truth about scabies. If you've traveled the world like me and been in many different types of accommodation, there might have been times when you woke up and you thought you're itching, or in the morning you'll notice a red mark and you wonder, is there bed bugs around? Are there scabies? In this video, we'll cover the causes, the symptoms, and how to treat your scabies as quickly as possible. Scabies is only found in unclean environments. Scabies can affect anyone, regardless of personal hygiene or living conditions. Scabies can be transferred by a handshake. Scabies typically need prolonged skin-to-skin contact to transfer the mites which are causing the scabies. Pets can spread scabies to humans. The scabies mites that affect humans are different to the mites on animals. Scabies is an infection that affects millions of people globally. Scabies is an ancient problem and has been talked about for many centuries. You may have heard of it before, being referred to as lice of the flesh. What is scabies? Scabies is a skin disease caused by mites called... These are tiny parasites which cause burrows in your skin. This is a highly contagious condition, and it often presents as an itchy rash. Imagine tiny creatures under your skin creating intricate tunnels and laying down their eggs. This results in small raised red bumps that you might see on your skin. Symptoms typically appear 2 to 5 weeks after you have an infestation. Symptoms that you may have noticed with scabies can include intense itching, especially worse at night, a rash that might look like small red pimples. The itching and the rash are more severe in some areas, such as your wrists, your elbows, in between your fingers and your feet. The mites that cause scabies typically like to live in folds of your skin. That's why you often have itching, which is worse between your fingers, your toes, around your genitals, any elbow creases or knee creases. How do you catch scabies? The mite that causes scabies transfers from person to person through close contact. It's not commonly just from a handshake or a quick hug. It's normally by living in crowded spaces like hostels or in school environments, or perhaps in care homes. Sometimes you can spread it from bedding or sharing towels, but this is much less common. Did you know that scabies can affect everyone, regardless of your gender, your color, or your race? The life cycle of scabies is fascinating. When a male and a female mite breed on your skin, the male then dies, but the female then burrows into the top layer of your skin. Each mite usually lays between 2 and 3 eggs around its 4 to 8 week life cycle. These eggs then hatch into baby mites. The baby mites take around 3 weeks to become adults, and when the mites become adults, that's often when people develop symptoms like rashes and itching. This is why usually you have a scabies infection for a few weeks before you develop symptoms. This is why if you leave the scabies untreated, it can transfer from places like your hands, where you might have had the first bit of scabies infection, to other parts of your body. So the scabies infection or the scabies infestation can continue to spread for over weeks or months. Diagnosis of scabies. Scabies is often misdiagnosed as eczema or an allergy because it often presents with a lot of itching symptoms and a red rash. And as a doctor over the last 10 years, I've seen scabies many times, and there's key things to look out for when you try to tell it apart from other skin rashes. Scabies is typically worse at night. We classically look for burrows between hands or in certain folds of your body where the mites are laying their eggs. Often they look like red bumps looking like this. In some cases, if we're not sure exactly what's going on, we might refer you onwards to a dermatologist, or in some cases, we might take a skin scraping, a small sample, and look under a microscope to look for the tiny mites. How do you treat scabies? Treating scabies is often straightforward, and your doctor will advise you on exactly what you need to do. The go-to option for most doctors will be a solution called permethrin. You usually apply this solution over your whole body and leave it on for around 8 to 14 hours, so most people put it on before they go to bed and then wash it off in the morning. If you apply the solution and then you go to the toilet and wash your hands, make sure you reapply it in any places you've washed your body. Usually you need 2 applications, normally 1 week apart, and that's because you kill the live mite and then you need to kill any babies which have hatched. In some cases, oral medication might be used. This is usually in severe cases. Other key things to remember is to make sure you treat the whole family or anyone you're in close contact with, because you don't want to reinfect each other. And you wash any bedding or clothes at high heat, usually above 50 degrees. If the itching is severe, you might need additional treatments like antihistamines or creams, which your doctor will give you. Secondly, if you develop an infection as a result of itching your skin, and this is usually because you break the skin by itching and cause an infection on top of the scabies, you might need further treatment like oral antibiotics or antibiotic cream. If you've recently taken treatment for scabies and it's been around a month but your symptoms have not improved, you need to see a doctor, and that's because there might be an alternative diagnosis, or you might have an infection on top of the scabies, and it's a good idea to have it reviewed to make sure you know what's going on. Scabies is caused by mites. Most people get bad itching and a rash. It's usually easily treatable with solutions like permethrin. If you develop additional infections or you have severe infestation, you might need extra treatment. As a doctor for over 10 years, I wanted to share some of what I've learned with you. Over 99% of you do not click subscribe, and it really helps me and my channel to keep growing if you click the subscribe button. Thank you for watching The Traveling Doc.